Hello everyone. Today I'd like to address what is traditional Chinese medicine, what is TCM, and I hope to share with you some of the enthusiasm I feel for TCM and share some of the insights from the ancient and for the most part distinguished Chinese culture. This talk is scripted. Some of the precepts you will hear are indeed ancient. When Hippocrates was sitting under the tree of knowledge forming the basis of Western medicine, the Chinese already had a functional system of medicine dating back perhaps 10,000 years. Much of it which has made it through to the present day. And for many years, Chinese medicine has been an option for people seeking something a little bit extra in their healthcare. Most people in the Australian community would possibly label TCM a therapy without thinking much more about it. They might think TCM is acupuncture in much the same way as we think of naturopathy as potions and diets, or osteopaths as spinal adjustment. In fact, thinking Chinese medicine as acupuncture is far from the truth. It is more correct to think of acupuncture as just one tool in a vast and complex toolbox. In fact, the high level of TCM has been, and is today in China, a fully integrated mainstream medical profession. Whether Western or Eastern, any medical treatment approach has a specific domain of influence, and this domain of therapeutic influence may even share a common effectiveness when applied to the same specific situation. Yet, each therapeutic approach has a limitation, the boundary beyond which it rapidly loses effectiveness and, in extreme cases, may become detrimental, more detrimental than the help that it perhaps offered initially. The human being is multidimensional. Each level, skin, blood, joints, bones, organs and spirit, is a complex integrated network, any of which has a separate specific requirement regarding therapy. And TCM as such, because of that, evolved as a holistic medicine and has at its component parts specialities that address each level of being: mind, body, spirit, physical body, subtle body, blood and fluid circulatory systems, vascular systems, nervous systems, the way that the body moistens itself outside of the vessels. When we drink water, it all drops down to the stomach, to the pit of the stomach. It has to move and spread everywhere. How does this movement occur? So many different aspects to think about when referring to medicine. The 5 methods of TCM are massage and bodywork, which addresses the superficial body and integrity of body musculoskeletal structure. The integrity of structure, so the pressure systems can move out and return, move out and return. No pockets of stagnation, no interruption, the exchange between the pure and the poison. Acupuncture, affecting the yin-yang energy dynamic or qi. Acupuncture affects the qi dynamic and used as an aid to release internal pressure and to ease blood circulatory systems. herbal medicine pharmacology to affect the material substance and the organ balance via ingestion. Substance to nurture substance. Dietary therapy, similar to daily balance the physical body's yin-yang according to lifestyle and personal constitution. The physical arts therapy, prescribed exercises to counterbalance disruption of natural body equilibrium from overuse, poor body habits during daily lifestyle, or corresponding underuse. So many people in our society today have got, the bodies are too weak and too cold and you know, so the elements are too strong. So anytime there's strong emotion or strong wind or strong cold or strong wet or strong heat, their physical bodies are so soft and underdeveloped. This is a big problem in the inner city, and it is a characteristic of a modern age. So Wu Yi is the martial arts exercise therapy from those traditions, and highly trained people of Wu Yi can perform traditional tactics concerned with skeletal alignment and the bodywork of the old culture. The 5 methods described above are serving overall to address issues concerning integrity of physical structure, re-establishing the free flow of the energy dynamic, the qi dynamic, and blood-lymph circulation. Also to re-coordinating the function of the yin and yang organs. Also education in prevention and self-cultivation. Those of us at the cutting edge of clinical practice are acutely aware that TCM offers a genuine alternative or adjunct for health and prevention. The combination of the 5 treatment strategies used together in an integrated way represents a far greater potency than the application of a single modality or a single procedure. The potential for TCM to fulfill the role of companion for mainstream allopathic medicine is a reality. And the essential reason why TCM might be considered able to fulfill this role is the historically sound base for addressing the following issues. 1. The ongoing quest to affirm the best way to maintain health throughout life and well into older age. How to prevent disease and or to reverse a disharmony at an earlier stage before an actual breakdown of health. To find the best way to manage chronic disease, i.e., how to lead a person back to health after the fact of a breakdown. The relevant consideration regarding these issues, and when contemplating or considering our healthcare system, we have to take into account, and societies have to take into account, the expense of allopathic Western medicine, the costs of modern technology, drugs, and the high-level training of doctors has become an inhibiting factor. So too, the ongoing issues concerning drug side effects, and all of this will continue to be so. There is growing awareness widespread throughout the medical and general community, and I've heard that from, friends who are medical professional and throughout Australia and China, regarding an effective adjunct to mainstream Western medicine, whether such exists, and if so, can it work side by side and be more financially expedient both for the society and the patient? These are not only my words. I've heard this said by Australian and Chinese Western medical professionals over the years, and recently in India from those at the highest level of government medical responsibility. The highest level of Chinese medicine has the lineage and capacity to fill this role. The higher level, not the basic level. China and India are growing in affluence. Both countries have adopted a combination strategy. Both governments fully support traditional medical teaching institutions and associated hospitals expressly for the purpose of supporting allopathic Western medicine in effective, affordable healthcare. The idea regarding TCM efficacy is widespread in China and was recently affirmed in Australia by visiting distinguished Professor Shi Danbang. This man studied TCM under his own father, a famous TCM scholar, and at the age of 26 he was asked by the Chinese health minister to study and practice in Western medicine, to compare the two disciplines and to find the distinct advantages and disadvantages of each. He wasn't the only one, but this one is the one I know of. Oh, well, I actually know a few of these people that were asked at a similar time to make an extensive 25-year study. His quest evolved into a lifetime's work, and now at the age of 65, 70, and one of China's most senior physicians, he reported to the government glowing recommendations and the need for TCM use in mainstream healthcare. And recently at another conference I heard another senior oncology expert, one of the highest in the land, relay the dynamic efficiency of TCM in support of chemo or radiotherapy. He stated, 20 years ago I would not have been able to say what I can say today. Now I know I can. Human life was not designed or meant to leave a person suffering in pain, to lose their natural nature, their sense of who they are, even when time to die. The side effects of even the harshest treatment can be relieved with Chinese medicine, and I know that a person does not have to suffer. He's written a magnificent textbook about this thick, which I have in my clinic, regarding cancer treatment with Chinese medicine, to balance and work with Western medicine. What is the philosophical basis of TCM? Yin and Yang theory. There are many theories. Understanding the nature of change between opposite polarities. The universe is comprised of yin-yang changing. Nature exhibits hot and cold seasons. A human being has a physical body, a spirit, and 12 main meridian chi channels, circulating our energy dynamic, the chi dynamic. Human beings display deficiency and excess. A balanced lifestyle will strengthen both the physical body and the spirit to form an integrated combination where each can balance and harmonize the other. When a person can manage the polarity yin-yang shifts of the universe, assimilate the knowledge of chi or energy dynamic through the circulation through the body, and adjust appropriately to the rhythm of the 4 seasons, TCM declares they will have clarity of spirit and not be assailed by any physical disorder. This is the foundation for maximum potential, leading to long, healthy and happy lives. Traditional medicine is the study of Xing and Shen. Xing is the physical and Shen is the spirit, which includes all mental, emotional thoughts and feelings and drive towards, or feelings regarding, the purpose of life and the energy behind making that purpose come true. The classic of traditional Chinese medicine, the Huangdi Neijing, elucidates. When the yin-yang of a person's Xing, physical yin, and Shen, spirit yang, is balanced, a person will be healthy. When a person grows normally, health will be and should remain a natural state. When sick indicates a breakdown of natural health. When sick, we employ the Xing, physical, and Shen, spirit, diagnosis and treatment and method in order to again balance yin and yang. Throughout ancient times, when sickness manifested, practitioners would work to balance Xing, physical, and Shen, spirit, to restore health. When you visit a TCM practitioner at the high standard, the first thing they will examine is the integrity of a patient's physical structure. And this will include all aspects related to the integrity of structure. Like any physical structure, a building, a skyscraper, if there's a twist, a kink, a hunch, or a blocking, then the doors and windows cannot open properly, the elevator cannot go up and down properly. When structure has true integrity, it allows internal circulation to spread outward and return with an even flow, thus maintaining balance of internal pressure systems, warmth, heat, qi, blood and lymph. When structures have a problem, inhibits these systems, causing to a lesser or greater extent back pressure, clumping, stagnation, bruising, areas of deficiency and regions of excess, all of which cannot always fully return to a natural stasis, thus providing the basis for disease and disharmony. When a practitioner can recognize, relieve and correct these problems utilizing a variety of specialist methods, can represent the quickest and most effective method of addressing the cause rather than just the symptom. I always see it as my quest to understand why is it like that? Why? If you can understand the foundation cause, everything can change. If you're just working on the symptoms relief or compensating for what the body's not doing for itself, it's only a matter of time when the collapse will go beyond what compensatory factors can do for it. Disharmony may not be directly related to the body itself. The origins may be from a mental, emotional, spirit problem causing a draining of the physical body energy or resources. The spirit of a person can become unbalanced from an excess of the 7 emotions, or from excessive alienation or exploitation. But the 7 emotions are Si, overexcitement; Nu, anger, hostility; Yu, melancholy or sadness; Bei, sorrow, grief; Kung, terror; Jing, fright; Shui, anxiety or thinking too much. All of those excess or sudden strong or prolonged over time will drain the organ system most related to the manufacturing of that emotion. Sadness injures the heart, grief injures the lung, thinking too much, anxiety, pensiveness injures the spleen, fear, terror injures the kidney, and that's the 5 yin organs, and the emotions associated with anger injures the liver, of course, hostility. So now we have covered some backgrounds and philosophy. What about some specifics? It would be somewhat easier for me to stand here and discuss different treatments and say we have a wonderful standard of treatments for diabetes or stroke or migraines, heart disease, cancer. In fact, TCM treats all these problems. We do not diagnose the disease, we diagnose the body. The disease is just the description. The body is the cause. So we don't, though it can be that there are standard treatments, but we don't usually treat disease in a formulaic way. While some herbs or some parts of the treatment might be in common, we always address treatment to the specific individual. So I do address these issues on a daily basis, but not in the way you might expect. Now I want to try and share something of my experience, what it is I have definitely come to know. Western medicine is excellent at controlling the manifestations, symptoms of disease, and offer dynamic drug intervention to control, some would say force, order on the body. The drugs control the body, and surgery is obviously a blessing for many, as is drug therapy, of course. How many people have been saved by oxygen? How many people have been rescued by penicillin, which is a herb, from a growth from a mold, a herb? Both of these approaches, drug intervention and surgery, are both accompanied with some side issues. Mind you, without this approach, often the issues would even be more severe. Some might postulate Western medicine is reactive rather than preventative, and think all saints, and thank all saints to be born in an age where we are in the presence of Western medicine. The idea is to use the best of both and be perfectly appropriate to the situation. That's the skill, that's the calling. If the hormones are low, prescribe hormones. If the body grows cancer, kill the cancer, the cancer cells, or cut it out. If your body allows the growth of bacteria, take antibiotics to kill them. If you have a headache or pain, take analgesics to sedate the nerve endings. If you have a headache, if you have to take opiates, these sever the connection between consciousness and the physical body at the myoneural nerve junctions. If the blood is thick, thin it. If you cannot breathe, take Ventolin or something similar to ease the vasodilation or create vasodilation. These days, a very common complaint is my immune system is low or fluctuating. which is a sign to us that the overall vitality is very low. In this case, take some steroids. And it's all wonderful when used correctly and with, a profound discrimination. And it is wonderful in time of emergency at the onset of a critical event. But is there more to know? Of course there is. In the way that I have been trained, and from what I see every day, the story can hold further dimensions. Perhaps an example. Let's talk migraines. Every medical or therapeutic discipline agrees that migraine is head pain, accompanied often with other features such as visual disturbance, nausea, vomiting, aversion to light or sound, sensitivity to touch, and sometimes it's totally debilitating. All you can do is shut down and go to bed. I have seen many patients with migraines, all of which, after they having travelled the road of Western medicine, all of them coming right through that road, not at all better and sometimes even worse than they were before they went there. All of them only having an option of the strongest painkillers, Panadol Fortes and beyond, as their options. One man owned 3 McDonald's restaurants. He had a Porsche, thinking of a Ferrari, a large mansion and a big family. When you look at him, you could see that he had a red face, very big-bodied, a little bit big-bodied and overweight, constantly on the move from morning to night. He had travelled the world seeking aid for his migraines. Nothing. On his first visit, I shared with him that the problem was with his stomach, and that this was the underlying cause of the migraines. Basically, from morning to night he rushed his meals, drank too much coffee with burgers while on the run, and coming home at night for big, rich meals with the family, usually later at night before bed. His stomach was overwhelmed by phlegm accumulation, causing heat toxin. That's a yang toxin, and yang toxins always rise. So the yang toxin was rising and settling in his head. Another patient of mine is a famous dancer, but particularly Australia-wide famous at a certain point. A magnificent dancer, so, very, very powerful. But slight of body, pale face, who thought she needed to keep her weight down in order to look good. She snacked on Vita-Weets and drank 10 cans of a famous cola drink daily for energy. Her stomach was the opposite from the case above. Here was a cold, damp accumulation causing a yin, or a cold, deficient toxin. Toxin is still toxin, and all toxin has a yang nature, whether they be a yin toxin or a yang toxin. And the toxin eventually rises as the heat in a compost bin rises, and it swells the brain. So opposite cause, same result. Her adrenals were massively overstimulated by the caffeine and sugar, plus the big sweats from dynamic performance. and thus her kidneys depleted, causing 4 kidney failures in 3 years. Here was a superb dancer, an athlete by any measure, a body far more evolved than the average Joe or Josephine, with migraines and kidney failures before the age of 24. Another man constantly put himself under pressure because of his personality. Always talking and worrying, pushing too hard in business, waking every night for years, dwelling on problems, turning, is never able to sleep properly despite having no real life problems. Beautiful wife, beautiful family. He couldn't let go because of strong emotion. His worry, knotting his stomach. You know that knot when you're under worry? That's acid being created from the food in the stomach. Causing acid and sour. He creates acid and sour the gut. And as a lifestyle, the sour just remains and the acid just remains, and it affects, you know, the acid balance of the blood. But what it's really doing in the gut is creating wind heat, gas, wind heat accumulation, not damp accumulation, not phlegm accumulation, phlegm and heat, but wind heat. Thus, the wind heat rising to cause the migraines. His migraines are caused by temperament. Another man was typical of a lot of common headaches, and that is the neck and shoulder relationship. The shoulder girdle connects to the trunk. The neck connects to the trunk, and the neck connects to the head. And these are vital gateways. If there's a kink, a twist, a hunch in the shoulder girdle, where the neck connects the trunk, where the head connects to the neck, then it is easy to have you know, severe headaches that can approach the intensity of a migraine. And as a body worker and massage, you know, medical massage professional, familiar with the physical arts of Chinese medicine, you can feel the bunching of the muscles and the swelling of the muscles and the wind and the heat that gather in those regions, thus blocking, you know, the profound and dynamic circulation through the neck. You have nervous system circulation, blood circulation, lymph circulation, chi or energy dynamic circulation must come up and go down again. Everything comes up and goes down again. It's got to come through. It's a thoroughfare, a consistent thoroughfare. So blocking is another cause for headache / migraine. So what have we got here? All of the above subjects have been on similar medications for years and years. McDonald's man was from excess, a yang condition. He had chronic food stagnation in the stomach and intestines, building upward pressure, and basically was digesting hot toxin on a daily basis. 15 years after this diagnosis, he had to have treatment for stomach cancer. He came to me for 10 years, but then I didn't see him for 5 years. And then when I did see him, he'd been diagnosed with stomach cancer. The dancer built upward pressure to the head from extreme deficiency, a yin condition. Everyone looking at her thought she was so fit, but I knew different. I knew she was cold inside. She was just putting external cold to the internal of the body. Does the body heat the stomach, or does the stomach warm and spread, or does the stomach heat the body? Here we see the same symptoms, but from an opposite cause. The next migraine was caused by strong emotion, pushing too hard as a daily lifestyle habit, always spending more than he earned. And as a result, because he pushes too hard, and as a daily lifestyle habit, he pushes for a result that is forever just out of reach. This man wants too much, always wants more, always not quite good enough, always need to strive just that little bit more, always overworking, never rest and work. He made his gut and his gallbladder and his liver and his blood toxic from stress. The next one was from postural irregularities, poor postural disciplines in daily life, blocking circulation through the head and neck. One excess, one deficiency, one strong emotion, one from physical body structure arrangement. All people completely different, causing migraine. All of these people desperately needing to find out something, a dimension to their experience, a dimension or an understanding that was missed at just the time when they needed it. Thus, this disharmony was allowed to manifest. They needed to find out why they had this problem, as well as receiving strong medication. And this is my daily experience with all disease. There is always a reason why natural balance falls out of harmony. Health is a natural state. Sickness is not a natural state. Health is a natural state. If there's sickness, there's a reason. There's a reason. And this reason can be understood. Of course there's a percentage that you can't help, but it's a tiny percentage. Tiny percentage. 0.5%. Can't do anything. A practitioner must diagnose the person as well as the disease. And this is the future of medicine. And this is the future that is coming. To finish off, I would like to share a story of when we were in India recently. Professor Wong, my teacher, my mentor, and staff was invited for a state visit by the Deputy Chief Minister of the Punjab state to present Chinese medicine to the Western medical community there and to the Ayurvedic medical community there. Professor Wong willingly displays total conviction about the efficacy of TCM, and nowhere else was his confident and consummate skill more on display than when we walked, surrounded by the doctors of the internal medicine ward of a major Western medical hospital in India. This was Punjab's largest government Western medicine hospital. We found ourselves within the internal medicine wards. And here we were passed from the ward director to the ward doctors. Professor first attended a man who was kept immobile with severe chest pain, chronic for the past 2 years. After examining his pulse, tongue, eyes, etc., he declared the problem was not with his heart, explaining why the variety of heart medications were not working. Professor asked the man to stand up in order to check for further signs. Professor pointed out to those assembled the way his rib cage and shoulder structure, shoulder girdle, was causing pressure upon the chest. So the shoulder girdles had actually compressed the heavy shoulders were compressing on his rib cage, blocking the heart. And this was caused from overworking his right side in his manual labour job. Professor then proceeded to stretch and pull the man's body using the specialised methods of Wu Yi, the great body work of the old culture. You yourself, your body has to have a tactile evolution before you can even do anything. You have to train the body, and then you can study these tactics, which immediately eased the pain. Immediately eased the pain. The pain that had been with him for 2 years, the compression. The professor then taught him 2 specific exercises for prevention and to train the shoulder girdle back into its natural state, and that would ease the problem. At this point, our audience of ward personnel began to increase as word passed around. Professor Wong attended a stroke patient suffering left side paralysis with speech impairment. Prof pointed out a distinct indentation on the right side of centre at the top of his head, saying this was indicative of stroke. He then told everybody that the cause of the blockage was from an excess of strong emotion, which built internal pressure, causing a critical event, in concert with a severe twist of the neck and shoulder relationship, both of the above together blocking the blood circulation through his head. As Professor pressed into the neck, the man could feel the pain of the twist. Professor asked some of the assembled ward doctors to feel the neck and the inflammation there. They nodded their agreement, and Professor explained the twist of the neck was caused by the man's left knee and ankle, because over a long period of time both were not seated correctly, thus creating poor weight distribution upon the rest of his body, finally disrupting the cervical vertebrae of his neck. So every time he walks, he's walking like this, and bang, suddenly neck's got a severe kink, and the muscles on one side are bigger than the muscles on the other side due to the equilibrium of the body being disrupted. Professor then proceeded to exercise a variety of masterly manoeuvres to the man's back, hips, legs, knees and ankle, which gave an almighty crack, and finally his neck. With this, the man felt immediately better. When Professor Wong first started examination of the ward patients, I was sure, absolutely sure, the doctors were wondering what in the world is going on. Because of this, I began a running commentary describing what Professor was doing in an attempt to articulate the principles behind his actions. It soon became quite apparent to me that these bright, seen-it-all, hardened, coal-faced professional doctors of internal medicine in the most famous internal medicine ward in the immediate land changed with the growing awareness that they were seeing something special. What I saw was that they were realizing another side of cause and effect, one they hadn't ever considered, but immediately grasped and recognized as they heard and saw it. Doctor-like stern concern transformed into animated interest and enthusiasm. Suddenly, we were being led from patient to patient, seeing the difficult cases. In one bed lay an unconscious man. He had been there for 3 weeks, his eyes open and rolling. He couldn't see, even though his eyes had opened in the last couple of days. The doctors told us they had performed every imaginable test to find out what was wrong. They could find nothing, and they were reduced to doing nothing. All they could do is feed him and wait. Professor was able to give them an explanation that helped them. Prof administered to about 10 patients before being ushered into the doctor's ward offices and refreshed with a drink. Our companions were enthusiastic and complimentary and expressed a marked interest in the source of Professor's knowledge. They invited him to return one day to share his knowledge, and they were overwhelmed to learn Professor Wong was approaching his 87th birthday. It took a director's summons to return us to Madam Director's office. We reluctantly took our leave of our new friends, with the hope in our hearts to return some day. We were offered teaching positions over there if we wanted to take it up. So, as an introduction to traditional Chinese medicine, I hope this facilitates the desire for you to know a little bit more about the authentic or the high standard, the high level. You must find the high level and understand that this is an ongoing and continuous medicine that has not just evolved in the last little while. Some of the herbal combinations have been used for thousands of years. They're just classic, standard, stock standard, traditional combinations. You know, honeysuckle and chrysanthemum for sore throat, barking cough, you know, wind heat, honeysuckle, chrysanthemum. In a fat person, accompanied with other people, with a skinny person, other people. For a pale, weak person, accompanied with other herbs. For a big, strong, robust person, would be with other herbs. But those first two herbs would be the same, honeysuckle, chrysanthemum. And throughout Chinese medicine, you see that there's an ancient tradition, and that it just, until you get to the really, really serious diseases, the basic 300 herbs used on a daily basis are generally very, very benign with very, very few toxic contraindications. So I hope this talk represents an introduction to Chinese medicine and as an education to understand a little bit more about its purpose and function in relationship with the best of Chinese medicine, with the best of Western medicine. So I wish you a good day until we meet again. Thank you for listening. Bye-bye.